I want to start off by going around and asking you, Toronto, Canada's most populous, biggest city, in a lockdown as of Monday. Michelle Rempel, let's start with you. What are your thoughts?
Why are we here? Why don't we have rapid tests that could have enabled the country to selectively test people and selectively isolate people? Why don't we have at-home tests? When we started the pandemic, lockdowns were supposed to be a temporary measure to buy the federal government time to acquire things like rapid tests or at-home tests, or to develop a plan to distribute vaccines. And what we've heard today is that that's not there. You know, what's going to happen when you go to Mr. Alghabra is he's going to give you a lot of word salad, but he's not going to give you details. He's not going to talk about how a vaccine is going to be delivered or under what timelines. He's not going to be able to tell you when an at-home test is going to be there. And that's what we need. It is completely unreasonable, hundreds of millions of dollars of debt later, thousands of lives lost, to be sitting here and telling the entire Canadian public that they're supposed to sit at home. This is ridiculous. This is an abdication
but to be fair,
of responsibility and it's negligence. Enough is enough.
To be fair,
enough is enough. This is crazy.
But to be fair, other countries are going through this. Spain, France, Britain. You know, the second wave is hitting hard. We knew it would hit hard. Maybe not as hard as this, but I want to hear from Omar Alghabra. Should this lockdown be wider spread? Because today the Prime Minister was in front of Rideau Cottage telling us that it is really bad. But Omar Alghabra, you heard what Michelle Rempel just said. Should this lockdown, though, be wider spread? This is a conversation that people are having across the country.
Joyce, thank you for having me on your show this evening. Look, today is a somber reminder to all of us that we are still going through a global pandemic. And we need to do, as individuals, everything we can to avoid the spread of this virus. And you know, the Conservatives seem completely out of touch with what is going on right now. The entire
world I'm going to interrupt you. I'm sorry. I'm sorry, Mr. Alghabra. I'm going to interrupt because this is not, I don't think, a time for you to start squabbling here, because the Prime Minister, in front of his own residents, saying basically we all have to be very careful, and that's it. I'm leaving it up to the provinces. Is Justin Trudeau suggesting that the provinces should go into lockdown, or why not try for a concrete national plan of some sort?
Look, Joyce, if you recall, at the beginning of the pandemic, there were also questions about invoking the Emergency Act. And the Prime Minister said, no, we are in a federation. Every region has its own circumstances. It has its own powers. It has its own jurisdiction. So what the Prime Minister is doing, what our government is doing, is we're standing by our provinces and public health officials to make sure we do everything we can to respond to the circumstances on the ground. Like, I come to you from Mississauga, from the region of Peel, where also we're ordered into a lockdown. But this is the right thing to do given the circumstances, and the federal government stands ready to support individuals who've been affected, to support businesses who've been affected, and we need to do this until we get over to the other side.
It's been 11 months.
Okay, Don David, go ahead, Michelle.
No, it's been 11 months. I want my colleague Dawn to get in as well, but I'm just going to say this. Civil liberties are being infringed upon. Businesses are being lost. People are losing loved ones by not being by their side at long-term care facilities. And you're just saying Canadians need to do more? Where are rapid tests? Where are at-home tests? Where's the plan on the vaccine? This is 11 months, and all you're saying is that Canadians need to sacrifice more. No, enough is enough. Stop it.
Okay. I want to ask Don Davis here. I want to get him in this conversation. Where do you stand on this? Should there be a national lockdown? Should there be a sort of more coherent plan across the country? Because this is like guacamole. This one today, this one tomorrow. We're in a red zone, we're in an orange zone, we're in a purple zone. It doesn't make any sense anymore. People are not listening. The doctors are telling us in their modeling that they had not taken into account COVID fatigue, people not listening anymore. So what is the solution? Maybe you in Parliament can sit down together for once and figure out something that makes a little bit of sense. We're not blaming you for the pandemic, but you're trying to manage it. Are you managing it properly?
Well, I think there's a little bit of truth in what both Omar and Michelle are saying. It is true that primary health delivery occurs at the provincial and local level, and I think any plan does have to be sensitive to those local realities. But at the same time, there is obviously a very, very strong imperative for national leadership and national coordination. There's things that can only happen at the national federal level. And so I think when
Give me an example of that. Give me an example of that, Don.
Well, for instance, in the United States, the Center for Disease Control has coordinated on behalf of all U.S. states a plan to be ready for vaccine rollout. They said that as of November 15th, all states have to be ready to roll out a vaccine, and they have a plan that is detailed for how vaccines, when it's approved, can be rolled out within 24 hours. That's something that the federal government can take a leadership role in coordinating. So they should sit down with the provinces and say, when we get a vaccine here, let's sit down and roll our sleeves up and say, okay, how is this vaccine going to be distributed across the country? Is it going to be the Canadian Armed Forces? Are we going to get the Canadian Pharmaceutical Association and Pharmacy Association together so that we can coordinate a plan for all the pharmacies across the country? You can't leave that to each individual province to replicate in a redundant way the same planning over and over again. This virus doesn't know borders. It's something that's going to occur across this country, and this is something where the national government should be convening the provinces together to come up with a coordinated plan so that we don't have to repeat the same errors and go through the same duplicative planning in every single province. And, we heard that at the health committee today, where the health minister came in, couldn't answer really any specific questions. Do we have a date for vaccine readiness? Do we have a plan for how we're going to vaccinate? Who's going to do the vaccination? Couldn't get any answers. 11 months in, I think that's not acceptable.
Well, Omar Alghabra, I think that is a fair, what Don Davis just said is a fair commentary. We have zero information here. I understand that we have to wait for Health Canada to approve these vaccines. I know they're not out of the gate. We know all this. So please don't tell us all about that. But really, we know they're coming. Do you get the feeling that your government is preparing for it? Because if it is, it isn't telling anybody, not telling the provinces, not telling the pharmacies, not telling the opposition. Who are you telling?
It's actually not a feeling, Joyce. I know for a fact that our federal government has been in discussions with the provinces and the territories on the delivery and the distribution of the vaccine. And I agree with you. I think Don is being thoughtful, and what he's suggesting is precisely what is happening. The federal government is coordinating with the provinces on the rollout plan. Now, I know he wanted more specific answers right now. Some of them are available, some of them are still being worked out. But the plan is being discussed and planned right now with the province.
When are you guys going to have the details for this to look at? You're telling us that there's maybe going to be vaccines delivered sometime in the new year, and you haven't told us how you're going to deliver that. Who gets it first? What the criteria are? Like, what have you been doing for the last 11 months? And now the Prime Minister has the audacity to come out today and say that Canadians should do more, or that it's good for businesses to have economic lockdown. Like, this is negligence, and you guys need to come out and have a plan that we can all examine on whether or not it's good for the country.
I got to correct you there. I've got to correct you there, Michelle Rempel. He didn't say it was good for businesses to have a lockdown. He said it's good for Canadians' health to have a lockdown, perhaps, and Canadians' health is good for the economy.
I can show the quote if you want, but he did talk about it being better for businesses to have an economic lockdown right now.
Okay, but I'm wondering if it's time for you in the House of Commons, for the parties that are sitting now in the House of Commons, to come together. I know it sounds very idealistic, but perhaps to have a conversation here about it, because now we're seeing a disconnect between the parties in the House of Commons, and we're also seeing a disconnect between the provinces, Alberta and Ontario, giving us the number of vaccines they may have. We have the federal health minister saying, no, not at all, nothing of this is concerned. So there obviously is a breakdown in communication between different levels of government and
don't accept
between different
that.
levels of government and Canadian people.
Joyce,
So
I don't
if I
I'm going to
may,
ask
if
you,
I
Don
may,
Davis.
yeah,
Parliament. We haven't had
if I could take it.
Parliament.
I can take a chance answering that. You know, we are in a minority parliament, Joyce, and I think you raised a really good point. Canadians don't want to hear squabbling between parties at the federal level, and they don't want to see finger pointing between the federal and provincial governments. They want everybody to be focusing on Canadians' health, and maybe it's time for the federal Liberal government to strike an all-party committee. Where we're all getting information at the same time. I think it's a fair comment to say that the federal government has been very, very tight-lipped, and they have not been very transparent. And you know, when you're dealing with a public health issue, or even things that where the confidence of the public is important to have buy-in, then when you're not sharing information, it leads to this kind of, at least a fear, and it leads to, I think, conflict that is unnecessary. I understand there are some things the federal government may have to keep to itself, but certainly there's a lot more information that can be shared with the opposition and parliamentarians. And I think it's time for that. We heard just today for the first time in committee that that the federal government has procured only 6 million doses of vaccine to the end of March. Well, at 2 vaccines per dose, that's only 3 million Canadians who can be vaccinated by the end of March. That's less than 10% of the Canadian population. To listen to the Prime Minister up to now, he throws out numbers like 400 million doses and we've got the best rate in the world. Well, when you delve into that and you find out the truth, well, actually, we've only secured a very small number of doses by the end of March. This is the kind of lack of information that breeds suspicion. And I think at the end of the day, the policy of the Canadian government will be better if they involve all the parties into more of the planning, so we can be a positive force to help improve delivery of services to Canadians.
So I want Omar Alghabra to answer to that, because you make a very good point, Don Davis. Mr. Alghabra, a little bit more transparency, don't you think that would be good? A little bit more transparency. Just tell the people the truth. Not false hopes, the truth.
Joyce, we have been telling the truth to Canadians and to parliamentarians throughout this process. And I welcome, and in fact, I agree with you and I agree with Don, parliamentarians of all stripes need to work together for the betterment of our country.
That's your job. You shuttered Parliament. You haven't allowed us to have committees.
To fight this virus.
It's laughable. It's enough.
Now the expectations of a virus, vaccine, is still ongoing. We don't know when the vaccine's clinical trials will be over. We don't know which vaccines will be approved. However, and by the way, the Prime Minister had conversations with the opposition leaders yesterday to brief them on what's happening, on the government's plan.
None of them.
And we will.
No, actually, no, Mr. Alghabra, the government did not brief them on the government's plan. It was a briefing by Dr. Theresa Tam on the modeling. That was the briefing yesterday. Now, that's unfortunately all the time that we have.